Hello and welcome everyone to today's webinar on strengthening the EU's response to prevention and control of antimicrobial resistance. This is the second installment in our AMR series this week, and we're very happy to have you here after we discussed on Tuesday about the socioeconomic drivers and impacts of AMR. So today we're really going to focus on implementation of effective strategies and think about the different possibilities and actions that can come in different sectors and from different institutions, focusing, of course, on the EU as per the title of the webinar. So if you're here, you're interested in antimicrobial resistance, you know this is a huge global public health challenge. We know that every year we have more than 1 million deaths due to AMR globally and more than €1 billion costs for European health systems. We also know that it is caused by the inappropriate use of antimicrobials and by insufficient prevention and control across a number of sectors: human, animal, plant, and environment. And therefore, we need concerted action across these sectors and a range of different strategies and initiatives to effectively work against it. So, and while we've been talking about antimicrobial resistance for several years, and we have seen that international, European and national initiatives in recent years have really accelerated, with a notable example being the establishment of targets last year at the EU level. We also see that the implementation of effective strategies in EU member states, but also, of course, in other countries, is generally lagging behind. It's inconsistent and generally slow. So what we ask ourselves at this point is, if we all have been talking about it for a while and we know it's a big challenge, why are we not doing what we know works? And of course, there is a lot of complexity combined with that. We need to understand what the key evidence-based strategies are that work, and we need to understand how to implement them. What do we have to do to overcome implementation barriers and actually effectively tackle key issues? To answer these questions and give some evidence on this point, the Belgian presidency of the Council of the European Union, currently ongoing, worked together with the European Observatory to produce a policy brief. I believe colleagues have already put the link in the chat, so you can take a look, that really summarizes the implementation considerations across a range of effective strategies to help us think about what the different roles are at different levels, because we need collaboration not only across sectors, but also across levels of governance, so both horizontal and vertical collaboration. So what we're going to do today is we're going to briefly look at the findings of the policy brief that will be presented by Michael Anderson, who is a GP and a health economist and works with us at the Observatory, mainly also at the University of Manchester at LSE. And then we have a stellar panel with us that will discuss their perspectives and also what they think are the key next steps to really strengthen the way that we address AMR collectively. And we have around the table José Domenech Amado, who is the Director for One Health, at the Director General for Health at the European Commission. We have Laurent Dubromfort, who works with the Federal Public Health Service for Service for Health, sorry, it's a long name, for Health, Food Chain Safety and Environment in Belgium, and was a key contributor to the policy brief as well under the Belgian presidency. We have Rob Butler, who is the Director of the Division of Communicable Diseases, Environment and Health at the European Office of the WHO. And we have Chris Fearne, who is the President of the World Health Assembly. So really a really multifaceted and very expert panel on this topic, and we really look forward to the discussion. A couple of housekeeping rules. You have the opportunity to interact with us and with our panelists via the chat. You can put your comments and your questions there. My colleague, Erica Richardson, will be keeping an eye on the chat throughout the webinar and will feed back to us at some point what your main points are in order for the panelists to also come in and comment. So I hope I have not forgotten anything key, and if so, please, colleagues from the Observatory, come in. Without further ado, I would pass the floor to Michael to give us a concise presentation of the key points of the policy brief before moving over to the panel. Michael, over to you.
Yeah, it's been amazing to have another opportunity to support a presidency of the EU Council, and the Belgian presidency came to us with the European Observatory asking for support with this specific challenge of implementing key recommendations to strengthen AMR policy. And this comes from the fact that for quite some time now, there has been consensus around certain key recommended interventions, but there seems to be a gap between what's recommended in policy and implementation on the ground. So the objective of this policy brief was about trying to map the enablers and barriers to implementation to strengthen the EU response to prevention and control of AMR. So we did a targeted review of key policy documents from the Commission, the WHO, the Food and Agricultural Organization, UNEP, the World Organization for Animal Health, and the OECD, and we identified 12 key interventions in human, animal, and environmental health sectors. So these are the objective of the brief. There are obviously other interventions that are recommended in the AMR space, but we wanted to focus on just a few key select interventions. So I'll just run through these very quickly. I'm aware many of you are probably quite familiar with them, but I'm also aware there's people joining from different sectors and perspectives. So when we talk about antimicrobial stewardship programs, it's about the multi-component interventions in hospital and community settings, the guidelines, the multidisciplinary teams, the monitoring and feedback mechanisms. And another intervention used to support stewardship is clinical decision support systems for prescribers. So these are the computerized systems that are embedded into software that provides reminders and advice regarding prescriptions to support stewardship. And control of falsified and counterfeit antimicrobials. This is increasingly becoming an issue in many member states that we're seeing. So falsified antimicrobials are those where they're essentially fake antibiotics that are often sold on online pharmacies, and counterfeit antimicrobials are ones that violate trademark laws. So that's manufacturers producing antibiotics without having the relevant IP rights. And then infection prevention control, we're talking about those programs that are implemented in hospitals to limit the dissemination and spread of relevant resistant pathogens. And for many of you, vaccination may go hand in hand with strengthening the response to AMR, but for some it still seems to be neglected in many policy documents. There was actually a paper that reviewed national action plans and found that many of them didn't even have vaccination as a priority, but it remains a significant tool to curb antimicrobial resistance. So from an animal health perspective, so we focus on 4 key interventions, so regulation and supervision to promote prudent use of antimicrobials. So this is the legislation that is put in place in various, so at the EU level and at the member state level, and then the accompanying policies that are implemented and the authorities that then subsequently supervise implementation of said regulations for prudent use. So this is around avoiding antimicrobials for growth promotion purposes or non-therapeutic purposes. Where improved biosecurity, we're focusing on the specific recommended interventions around preventing infection in animal health populations. So and also ensuring appropriate hygiene measures in agricultural settings. And again, vaccination is a key policy in the animal health setting, which is crucial to combating AMR, where food safety compliance programs relates to various stages of the supply chain related to food. It's about monitoring appropriate, monitoring residues of antimicrobial resistance, but also making sure that we're handling and processing food in an appropriate way to minimize the spread of infection. Now, moving into environmental health. So the EU is probably, I would say, is a best practice region in terms of how we handle our wastewater treatment facilities. There are lots of pre-existing regulations in place and lots of programs to ensure that EU populations have access to clean water. But there's increasingly discussion around the fact that there needs to be more consensus around what different interventions can be used to remove antimicrobial resistance genes from our wastewater supplies and minimize the concentration levels of resistant bacteria. So there's more work that can be done in this space. Whereas there is actually already consensus in the pharmaceutical industry around different concentration levels that should be adhered to in discharge effluent. However, they remain voluntary, and there could be potential to introduce mandatory measures related to this. And waste management in agricultural production is around how the agricultural sector handles manure from agricultural processes to minimize the distribution of antimicrobial resistance in soils and subsequent wastewater supplies. So it was quite a broad basket of interventions that we focused on. And for each intervention, we mapped the role for the EU, the role for member states, the operational considerations, the financial considerations, and regulatory considerations. So there are some quite meaty tables in the brief that outline these. And what we envisage this policy document to be is it's something that can be used by policymakers when they're revising their national action plans, just as an aid to strengthen the implementation of their policies. So we were conscious of the fact that many national action plans across Europe are currently entering a stage where it's phase 2 or phase 3, and they're revising their plans. So we're hoping this can be used in the next few years. So when we look at, so obviously I won't go into the nitty-gritty of each intervention and the implementation barriers because we have limited time, but just to give you a highlight of some of the key themes and enablers that were identified. So strong leadership was a recurrent theme throughout, but this is at multiple levels. This is not just at the national level where there's lots of AMR champions in relevant different member states, but it's also at the regional level and organizational level. And that leadership needs to be combined with clear roles, responsibilities, and accountability mechanisms for the relevant actors involved in using antimicrobials and prevention of disease. And to make sure those accountability mechanisms work, we need very clear monitoring and surveillance with rapid feedback. So this is not just about annual reports. This is about taking advantage of the developments in electronic healthcare records and digital health to make sure that we have as close as possible to real-time or rapid feedback to prescribers or those involved in using antimicrobials to strengthen implementation of recommended policies. And we can use to make sure that to further strengthen accountability mechanisms, it's about making sure that we have tailored targets and benchmarking. So there's been lots of discussion around targets at the national level, and it's a fantastic achievement that there are now targets in human and animal health at the EU level. But how are member states now going to implement that in practice? So increasingly, there was a discussion around the fact that we need member states to develop tailored targets that can be used at the regional organizational level to make sure that these feed down. And then it's about making sure there's reimbursement models that incentivize appropriate antimicrobial usage. So this is about many of the fee-for-service models that exist in healthcare and animal health are often incentivize increased healthcare activity. And there's a need to use mixed reimbursement models that can incentivize improved antimicrobial prescribing. So this may be pay-for-performance models or capitation models, and even service contracts that are being used in the veterinarian sector to incentivize improved adherence to stewardship. And this needs to go hand in hand with educational awareness programs to secure the appropriate buy-in of relevant stakeholders. And there needs to be adequate funding for research. So to ensure that we have evidence-based policies that are constantly being monitored and evaluated, but also we need increased investment in push incentives and pull incentives to stimulate the research and development of new antibiotics, but also into different incentives to secure sustainable access to existing antibiotics, which are often very vulnerable to shortages and withdrawals in certain markets. So when we come to the end of the brief, we say that to strengthen implementation, what we really need is this paradigm change or shift needed on collective responsibility and accountability. So this often is seen as someone else's problem, or someone else is developing a policy to look at this, but we need collective ownership of the issue, combined with clear roles and responsibilities, accountability mechanisms, and monitoring and evaluation. So the EU is often seen as a best practice region, and the EU has been successful at reducing antimicrobial usage in the human sector in many member states. But the EU also needs to think about its position internationally and needs to think about how we can keep AMR high on the international policy agenda. And there is a significant role for subsequent presidencies of the Council of the EU to achieve this. So once again, I'd just like to say thank you to the Belgian presidency for inviting the European Observatory to collaborate on this piece of work, and for the opportunity that's provided me as well. Thank you. So I'm just going to hand back to Dimi now.
Thank you, Michael. This was really concise and I think a very nice summary of what the brief has to offer. That chimes a lot with what has been going on in the chat. There's a lot of interest about how the strategies were selected and how the information was put together, but I think we come back to that maybe a bit later if we have the time, and you can tell us a little bit more. But for now, it would be great if we could have all our panelists on screen, because I think one of the key points that Michael makes at the end. So you saw the different strategies, you saw the common enablers, the key point of the need for a paradigm shift and keeping AMR on the agenda at EU level, at international level. And so what I would like to hear from you, you all bring different perspectives, is whether what you heard from Michael and what you saw in the policy brief chimes with your experience, and we're happy to also hear no, but then you have to let us know in what way it doesn't. And perhaps we start with you, Laurent. I'm not expecting you to say no because you were one of the stars of the policy brief, but perhaps you can let us know the thoughts of the presidency, or what you think of what you just heard. Over to you.
Of course. Thank you, Dimitra, and good morning, everyone. So first of all, I would like to thank the European Observatory for organizing this webinar and the great collaboration we had in writing this policy brief. So to come back to the questions, so I would like to first discuss one of the key messages that we saw at the end of Michael's presentation is the need of a paradigm change based on collective responsibility. What I mean by that is that the Belgian presidency has been a strong advocate to the One Health approach, which is central in the policy brief message. We all know that AMR is a complex issue that crosses human, animal, and environmental health, and tackling it effectively requires coordinated actions, of course. One example of this would be in Belgium, our ministry, where we have the animal, human, plant health, and environment all under one roof and increasingly working together. CNSANO, the Belgian Public Health Institute, is also a good example because it collects data from all pillars in order to ensure an integrated surveillance of AMR. Secondly, what is important, I think, is the successful implementation is critical. Since the Global Action Plan of the World Health Assembly in 2015, 178 countries have developed multi-sectoral national action plans. However, we all know that translation from NAPs into actions is still complicated, and only 11% of the countries have dedicated budget for implementation and monitoring, so this is still not enough. And in order to overcome these challenges, the policy brief highlights the need of strong leadership, clear roles, and accountabilities. And as Michael mentioned, the purpose of this brief was to outline key evidence-informed interventions that country can implement in human, animal, and environmental settings, but it also identifies some common barriers to action, such as resource constraints, staffing shortages, and misinformation. Finally, what I would like to highlight is that the role of EU institutions is crucial to support national actions. While the policy brief and the Belgian presidency, of course, emphasizes the key role of the EU institutions in setting legislative framework and providing technical expertise in order to ensure a more unified and an effective response to AMR. Thank you.
Thank you very much, Laurent. Also for the Belgian examples, I think we do that also quite a bit in the brief, that we pull examples from the Belgian setting to highlight the different elements. That's really, really helpful. And also, I think a very nice bridge at the end about the role of the EU to Rosé, who is next. Rosé, what you heard from Michael, but also now from Laurent, your take.
Thank you, and thank you also to the observatory for organizing the webinar. I mean, one of the things that we always insist is that we don't talk enough about AMR, the silent pandemic. So clearly trying to keep the momentum and talking about it, maybe in the end we make it. I'm obviously also very honored to have real authorities in the field like Chris Fearne and Rob Butler. So I'm very happy to be in this panel. AMR has definitely been a priority for the Commission, at least for the last 2 mandates, full mandates. And you know that there's been several action plans. And what I can see is that, well, if you wanted controversy, you will not have controversy in this question, because we all agree everything chimes with the policy brief. And you can see this very clearly also in the Council recommendation that member states adopted last year in June, I think, last year. So clearly, and I think that both Michael and Laurent said, is obviously the One Health approach. That's more than fundamental across human, animal, plant, environment, and food safety. Sometimes we also forget these elements, very important. For us, also very important, the need for measurable goals. Not only to, because they both put pressure, we will come back then to the sticks and the, but they put pressure, but also they are fundamental to monitor the progress. And clearly here, as we say, always what gets measured gets done. So we very much, and we can develop this maybe a bit later. I think that Laurent was referring to the national action plans. Clearly, even in the EU, many of them lack sufficient funding. And I think that this is also related to what I was referring to on communication. The more clearly problems and priorities are communicated, the more likely budgetary support to address these issues can be leveraged. And in that context, as you probably, most of you know, we have this second joint action where we finance with 50 million euros. It's a joint action with all the EU member states, Iceland, Norway, and Ukraine. And it also includes awareness raising and campaigns. We, from the Commission, we're also insisting a lot on that. We're meeting journalists, influencers, very important today on social media. And we're also doing campaigns for those that will come, for teenagers and teachers, so that they learn about this real horrible public health concern. Also, obviously, because the policy brief is very structured on the animal health related aspects and the importance of biosecurity, which is prominently included in the brief. Again, here the EU is front runner in proposing legislation to prevent emergence and spread of diseases in animals, and obviously the further transition to human. And also, very importantly, as it has also been said, AMR in the environment. And here, even we have a clear regulatory framework for wastewater treatment, which is actually currently being updated. We need to gather more knowledge and in order to make more evidence-based decisions in this area. And this is why also research plays a key role in projects. And I think that I don't know, Laurent, but it was mentioned in the a Belgian project in the policy brief in that sense, and we need to have more of them. And here again, the joint action is supporting member states for the development of environmental surveillance in the context of something horribly called EARS-ENV, which basically means European AMR Surveillance Network, in the environmental side. Two final things on that, maybe just mentioning also that, as you know, in the context of the proposal for the pharma legislation, the new pharma legislation, we've proposed to extend the environmental risk assessment of human medicines to cover the antibiotic manufacturing, and which is already the case for veterinary medicines. And of course, a point that is also mentioned in the policy brief, with which we absolutely agree, is the international arena and the role that the EU has to play a leading on that. So we're working really very hard to ensure that the UNGA high-level meeting in September, of which, as I was informally before telling you, Dimi, they've distributed already the zero draft, which is a very complete, pretty long document, but I think that at least it really, it's a very good basis for discussion. Thank you.
Thank you very much, José. I think with your permission, and because it fits very well, I will go to Chris first, because before going to Rob, also because Chris, you have a prior engagement and you need to leave us at some point. So over to you. You've heard quite a bit on the policy brief, but also from colleagues at Belgium and EU level.
Thank you.
Please.
In fact, thank you, Dimi. In fact, I'll jump in where Roser finished off, which is with the high-level meeting happening on the 26th of September. Because as many of you will know, Malta, together with Barbados, are the co-facilitators for this meeting. And as Rosa said, this is just hot off the press. Yesterday, we had the presentation of the zero draft, was distributed to member states the day before. And yes, it's forced the basis for the political declaration, but it already has some very important elements, including targets. For instance, one of the targets that we are looking for is to decrease AMR attributed deaths by 10% within the next 5 to 6 years, and then having another high-level meeting in 2029 to monitor on this. So, and there are other targets that are coming in. So it's not just a political declaration which makes everybody happy because it says nothing, but there's actually stuff in this. Michael made then a very important point, that yes, in a lot of aspects, the Europe or the EU may have best practice when it comes to mitigating or controlling AMR. I might discuss some of those, but generally yes. But Europe needs to think, and especially the EU needs to think about what its position with the rest of the world is. And when it comes to the high-level meeting, this is exactly it. You see, with AMR, because it's a global issue. Because if a new variant arises anywhere in the world, it will soon affect everywhere in the world. We've seen this with COVID, unfortunately. Because it is such a global issue, we have to think globally. But then we have to act locally to solve the problem, to mitigate the problem. So we have to think globally, but act locally. And we really, when we're putting targets out, when we are producing policy briefs, when we are saying, look, we need to do this, we need to do that, this is what works, this is what doesn't work, this is what the evidence says works. What we are saying is that we need individual people in individual countries and individual regions to step up to the plate. And this is not easy. And let me tell you why. In March, 2 months ago, I was visiting a number of villages in North Africa, not big cities, villages. The main mode of transport, and this applies for other low-income countries or low-income regions around the world, the main mode of transport is still now, this was in March of this year, is still the mule. Yeah, so people travel from one city or one village to another to the market on their mule. Relatively well-off people have 3 or 4 hens. Rich people have a goat. The very rich people have 2 goats. This is the reality in a lot of villages. I saw this with my own eyes 2 months ago. In Europe, sometimes we forget these realities. And what we are saying to these people are, if your chickens, which you depend and your family depends on your livelihood on these chickens and producing eggs, if your chickens have salmonella, then you need to cull them. If your goat has brucellosis, then you need to cull it, because otherwise it will give you more infections and the emergence of AMR. Unless we have concrete measures, financial measures to help these people do this, it's not going to happen. We are asking people to vaccinate their animals. In large parts of the world, not even children are vaccinated, let alone their animals. So we need to, yes, Europe is best practice, might have best practice, but we are talking about something which is global. And unless we tackle this globally, then we will fail. What we need to do, and we mentioned this maybe not as strongly as I would have liked to in the political declaration for the high-level meeting, is something which I would refer to as a fair transition or a just transition. In other words, those who we expect to make the biggest sacrifices and changes to mitigate AMR, and it has to happen because AMR is an existential problem, they need the most help. And that help, true, health is a national competence, but the problem is global. So that help, that financial help, we have to have systems in place, global systems in place, which make sure that AMR is being tackled at an individual level or all over the world.
Thank you, Chris. And just let me follow up on this, because I know you have like 2 minutes left to be here. The global systems that you're mentioning, part of that, of course, is the targets and the monitoring. Do you want to build on that a little bit, perhaps? Like, what do they look like? Yeah.
So the high level declaration will put a lot of responsibility on the quadripartite organizations. Yeah. So that have been mentioned already by Michael in the beginning, and the monitoring body to see that what we agree upon is implemented. But then also, and this has already been in the offing for a number of years, but hasn't happened, and we give a timeline till 2025, the setting up of a expert panel for independent evidence. So we need this, because we talk about policies, we talk about taking decisions, and we forget that this is science, and science needs to be based on facts. And sometimes we quote this figure, you quoted it at the beginning, of 1.7 million deaths per year attributable to the AMR. This is from a study from 2019. I mean, we're in 2024, and we don't have any data. We don't know what's happening in the animal kingdom. We don't know what's happening in plants. So yes, we need an expert panel to do this. And then there is, and I'll finish with this. And then there is research and development, which we need to finance. Now, with COVID, when the coronavirus started, when the pandemic started, we knew this was going to be serious. And we were right, because COVID has brought down life expectancy globally by 1.6 years, which is a big deal. So COVID, the 2 years of the pandemic, brought down global life expectancy by 1.6 years. GLG figures, Global Leaders Group figures, show that by 2035, with the current rates of antimicrobial resistance, the life expectancy will come down by 1.8 years, so more than COVID, and in low-income countries by 2.5 years. So that's a really massive thing. And yet, we're not putting the same amount of financing into research and development that we did with COVID. In Europe, with the advanced purchase agreements, we put in billions of euros. It worked. We had a vaccine within 10 months. We saved hundreds of thousands, probably millions of lives. But that was the political and the financial commitment. With AMR, which is probably going to have higher mortality, all told, than COVID, we're not even close to that. So that's my pitch. We need to be global. We need to act local, and we need to put the AMR pandemic into the proper perspective.
Thank you. Thank you very much for this, Chris. I think, and also, in a sense, put our money where our talk is, if I understand correctly at the end. Thank you very much. At any moment, if you need to leave us, you leave us, and we continue sadly without you. But thank you for that. Rob, we come to you with your reflections. Bring them in as you like, not necessarily only on the initial question of reflecting on the policy brief, but you've heard also all the other panelists by now. Give us your take.
Yeah, Dimi, a lot's been said. I actually forgot I was on the panel. I was so busy listening to Chris. I think a lot's been said. I'll keep it very brief. Cognizant we need to move on to another couple of questions, but really the findings, and Michael, thank you very much for a very good presentation. Thanks also to Dimi, the Observatory, for inviting me along today. A lot's been said. I think if I'm going to be brief, the findings of the policy brief are directly in line with our experience of WHO. As many of you know, 53 member states endorsed an AMR roadmap in October of 2023. And in that roadmap, we saw 50 interventions, tried, tested, proven interventions put forward and advanced and promoted to the member states. The policy brief, I really enjoy the way the policy brief frames the findings, recommendations, if I can call them that, in the One Health and to promote the One Health approach. This is something that we're going to bring to a high-level meeting at the very end of October in our next regional committee. And I know that we will spotlight this policy brief alongside the AMR roadmap on that occasion. So the evidence-informed interventions that the policy brief refers to, I think we fully support, endorse. I mean, if I'm to look at the meaty tables that Michael referred to in the policy brief, you know, if I just choose one area, for example, IPC, infection prevention and control, I mean, absolutely critical for tackling AMR, but also for advancing, of course, the WASH agenda, strengthening health security and so forth. I mean, in the European region, we're not there. We need these kind of policy briefs, not to just guide and inform, but to also promote and encourage action, and it's urgent action. I mean, on any given day, we have 90 to 100,000 patients with at least one healthcare associated infection. But despite that, we've got 2/3 of member states that don't have a national IPC program. So I really appreciate the way the policy brief is not just advising and guiding, but also prompting action in very much needed areas. And I mean, just taking IPC and harmonizing diagnostic stewardship to increasing the targeting staff levels for IPC nurses, ensuring sufficient isolation capacity and so forth. All of these things are very much aligned with our recommendations and our learning. And we're very grateful that we can come and join this panel today, of course, to discuss the policy brief further. But I just wanted to say that we're fully aligned and fully supportive. Thank you.
Thank you very much, Robert. As you know, the roadmap and the compass were really a source of important evidence and inspiration for the brief itself. So I thank you very much also for really pointing out this understanding of the evidence and the action. They go together, the different levels. I think that's really important. Let's switch it up a bit from what we were planning to do and go to Erica, if that's okay, to give us some reflections in the interest of time from the chat box, because with the corner of my eye, I have been seeing that there is a lot of activity in the chat box. And perhaps what I wanted to say in advance is that we will share, I think we can share the chat with our panelists, because there are a number of questions and perhaps insights that might be interesting for them. But Erica, give us a sense of what is happening.
Yes, thank you very much, Dimi. It's been a very busy chat box, as you said, and there have been some really interesting sort of points and questions. Some questions very specific about the brief, points of clarification. But in the sort of broader questions that have come out, for example, how can the EU strengthen collaboration with non-EU countries and regions and global health initiatives to address cross-border challenges in AMR? There's also a question about community engagement and the role of civil society in AMR prevention and control, particularly given that, you know, if we're talking about vaccination as one of the key strategies, we need to talk about community engagement. We need to talk about the role of civil society around vaccine hesitancy. There's also some discussion about the EU role in data harmonization between countries if we're going to be doing this monitoring of AMR. And I think I'm going to leave it there for now. And of course, obviously, the big elephant in the room is financing. Who's going to pay
Right.
for this and how?
Okay, yes. So this is the hardest question perhaps at the end, or maybe not. Okay, so we have, as far as I have at least noted down, Erica, we have the strengthening the collaboration between the EU and non-EU countries, particularly in the cross-border dimension. The role of civil society, I think that is important. It is within the brief in specific areas, but not as a separate strategy. So that's quite important, particularly when we think about vaccine hesitancy. I think this is brought up quite specifically. Data harmonization, and again, the role of the EU and the importance of that. And then the final hairy question of who is going to pay for that, or where the money comes from. I'm tempted to go to Rosé first, obviously because of the EU role, and then maybe we'll go to Michael with your experience from the brief, followed by Rob and then Laurent. Rosé, over to you.
Yes, thank you, Dimi. Well, One Health, it's what I have behind me, and it's already been said, and the policy brief says it very clearly. We absolutely need this paradigm shift to make sure that we work across not only the three sectors. I mean, in the end, we could talk about One Health ad eternum, because it really goes beyond the biomedical, I would say, sectors. But well, that's maybe for another webinar. But clearly, it involves political will, it involves leadership, collaboration approach, which requires changes in governance and organization. And most countries and organizations, including the Commission itself, still operate in very much sort of sector-specific silos through the whole chain of actors that are relevant for AMR. And cross-border infections as well, of course, and that goes from academia to interest groups and and all of them up all the way up to ministries, and as I was saying, it concerns the Commission as well. We have, however, and that's why I was referring to the name Beyond, is because we've created this new directorate, and that was, even if for the moment it has more a symbolic sense, but the idea is to start really working across sectors. And it starts in DG Santé, but obviously this collaboration will need to go far beyond our own DG. It's environment, it's agriculture, and you name it. But in practice, we're also starting to work across sectors with our networks. The most important one generally is the Health Security Committee, which was very well known during the pandemic. We are here working a bit more in the area of zoonosis and very clearly on avian influenza. We're putting the CMOs and CVOs, so the chief medical officers and the chief veterinary officers together. But also we have, as you probably know, the AMR One Health Network, which gathers government experts from the three main areas, but also the EU agencies and stakeholders. And we meet them at least a couple of times a year. And the idea is also to exchange best practices, build consensus, compare progress, and well, ultimately to obviously try to accelerate the national efforts in addressing AMR. You also probably know that our agencies, very specifically, obviously ECDC, EFSA, ECHA, so the Chemical Agency, EAA, Environment Agency, and EMA, Medicines Agency, they have a cross-cutting task force. And in that sense, they are giving us a real lesson, and we're working very closely with them. And they have just also published their framework for action and that concerns coordination, capacity building, communication, joint activities. So plenty of the things on where I hope that we will be obviously able to follow policy-wise. And on that, we are reflecting in view of the next Commission on several areas, because as you know, policy action gets very complicated the more you go European level. Okay, so for that we need to clearly define the scope for action, which areas could significantly benefit from further implementation of the One Health approach, the best governance, what coordination and collaboration mechanisms do we need that don't create, because also the risk is that we create an extra silo called One Health. So we need to be careful with that as well. When we're talking about governance, obviously we're talking about decision-making processes, and we're talking also about budgets. Budgets have been mentioned. Well, I'm only referring in terms of perspectives that our health budget has just been reduced for 1 million for a very fair cause, is to help Ukraine, but that suddenly all the cross-cutting things see the budget diminished at EU level. I can talk about budget and maybe what you mentioned from the chat on the collaboration of third countries maybe later.
Yes.
Absolutely. On our reflection, just a couple of things important that also were mentioned a bit. First, indicators to monitor and see how we implement the One Health approach. Very important, integrated collection of data. We saw that also for COVID, for AMR is fundamental. Capacity building, training as well. And as I was saying at the beginning, communication and beyond the community of specialists. So we have a body called Scientific Advisory Mechanism in the Commission. Okay. Yes, we're very sophisticated, and they are preparing a sort of an opinion that we will be using in view of the next Commission mandate, in the hope that the result of the EU elections will give us broader scope for that reflection, and in particular that implementation, which involves many things, including finances. Thank you.
Thank you very much. And I think we're all crossing our fingers for June 9th for the elections, exactly to go in that direction and not in a different direction. Michael, we come to you very briefly, so that we have just for a couple of reflections before going to Rob and then to Laurent.
Yeah, so just picking up on some of the questions that have been asked, I think I'll probably maybe tackle that specific question around civil society and about how we promote collective action related to AMR policy. So I can, perhaps it's something we could have emphasized more in the brief. I completely agree. It's a fundamental part of sustainable implementation of AMR policy. We need NGOs, and we need the public to press politicians to drive action to tackle AMR and keep it high on the policy agenda. And this has been used successfully in many countries. It was used in the Netherlands. We have the AMR Champions Initiative in the UK, where people can sign up as an AMR champion, and I think it's something 300,000 or 400,000 people have done this now. And we do actually cover this in more detail. There's a book that we published on economic policy challenges to AMR, where there's a whole chapter on civil society, and we've published an AMR governance framework in the Lancet Infectious Diseases that talks about the need for how you integrate civil society in decision making. So from design of AMR policies to monitoring and evaluation. So making sure that they're part of those fundamental multi-sectoral committees that drive implementation of AMR policy. So they have a place at the table to influence. And just another thing that's been picked up is the role of non-EU countries. I think this is really, really important. I think the EU institutions can think about potential opportunities to include non-EU member states in some of their initiatives. So whether that's creating opportunities for them to participate in joint procurement or knowledge exchange of relevant policies, and how they might translate to non-EU countries based on their country archetype. So whether they're a small country or a large country, or whether they are centralized procurement or decentralized procurement, and how some of the lessons learned in the EU member states can be translated into those other countries. So I think also that I need to mention the role of WHO Euro, because obviously WHO Euro has a key role in facilitating that type of knowledge exchange as well. And a good example of that is the novel medicines platform that WHO Euro is hosting at the moment with actors from across the WHO Euro region trying to do just that. So yeah, that's just some thoughts on this.
Okay, and you also give us the perfect bridge to actually WHO Europe. So Rob, over to you. High expectations. So tell us.
Thanks, Dimi, and thanks for that bridge, Michael. I actually wanted to refer back to the community engagement, and there was a referral to vaccine hesitancy. One of the chat questions was related to behavioral science, and I actually see behavioral science as having the answers to many of the questions that have been posed. First, around vaccine hesitancy, it's very obvious. Vaccine hesitancy is incredibly complex and context specific. We need behavioral scientists, social science to support us here more fervently in each and every member state. I won't go and discuss that now, but to say community engagement in terms of the second tier that I see behavioral science supporting us on is, of course, the prudent use of antibiotics and understanding the drivers and behaviors of individuals, community members, and then, of course, having diagnostic tools that will help us assess that. But also in the professional sector or in the health sector itself, segmenting the prescribing behaviors, for example, and those can often be in the same setting. So we take a hospital setting, a hospital prescriber and their drivers and enablers and barriers for appropriate prescribing are very different from a hospital surgeon and their use of antibiotics. In the same setting, two totally different profiles. So here again, I see behavioral science as playing a very important role and possibly a little under-recognized within the policy brief. If there was a weakness, and I'm a behavioral scientist, so I'm completely biased.
Right.
But the final point I would like to make here is also on the framing around antimicrobial resistance. I think we're over-medicalizing often the narrative on antimicrobial resistance. We're desperate for ministers of finance, ministers of interior, other sectors, particularly across the environment and the animal health, zoonotic sectors, to understand the challenge of AMR. So I think we need to move and shift the narrative and the framing, because when I speak to ministers of finance about supporting our work on AMR, I am not using the typical terminology we do within this little group of friends. I use untreatable infections, hard to reach infections, impossible to treat infections. I need the impact and the understanding immediately. I only have 2 minutes to make the case. So I think we have a behavioral science challenge here that is solvable, but we do need to reframe this slightly and think about the terminology we use, because often I do find it's too complex for other sectors to understand.
I think that's a really valid point. Chimes also with what Rosé was talking about earlier about clear communication, not only in different ways. So I think that's really important. Laurent, we come to you. I'll ask you to be brief if you can, so that we have a final lightning round and not be too late. Laurent, over to you.
Of course, I try to be brief, but yeah, I would like to come back to the public awareness and the education gaps that we have and that are still important challenges and that we highlighted in the brief. But I think that, effective AMR prevention and control really depends on the responsible use of antimicrobials, and it requires, of course, informed behaviors, as Rob said, by healthcare providers, but also by farmers and by the general public. And I think the key here is that misinformation and lack of awareness about AMR and its consequences also will lead to inappropriate use and poor infection prevention practices. We had the chance during the AMR conference to have a presentation about patient engagement by the European Patient Forum. I think this is also important because we really need, as policymakers, to put ourselves in the patient view. In the end, we're all patients, but to really realize how AMR impacts the life of many people, and that patient engagement is really important, even more for young people, I would say. That we need to create new generation, a strong awareness on AMR to make a really big difference, I think, in the future. Yeah, thank you.
Yeah, I think it's a really salient point, and also I think you also had a session on behavioral approaches during the meeting that was very spot on. So I think that's really a really good point to make. Point taken also for the policy brief. I think when we think about our future work on AMR, of course, in collaboration with all of you, we're going to think about that a bit more. We're almost at time, but if our participants allow, we might take a couple of minutes more, because I would like, as a closing round, a 2-minute statement from each of you on how we can actually drive change. So what are the carrots and the sticks that we need to employ? More carrots, more sticks, one way, the other way. Of course, you won't have time to go into it in detail, but perhaps just a rapid reflection on that, so that we close on that note of proactive and active way forward. Rob, we come to you first for that one, then Laurent, Jose, and Michael. Rob.
Yeah, I like the way that Michael put this. I mean, it's everybody's issue, but it's nobody's responsibility. Driving change here is going to take an all of society effort. There's no single organization or group of organizations such as the Quadripartite who are mandated to sanction. So I don't believe sanctions is the way ahead, but I do believe in carrots and sticks, as you put it, with mutual accountability. And here I think WHO need to step up and play a stronger role. And that's what we will be moving forward in this agenda over the next 12 months, because I do believe that what gets measured gets done. We have 53 member states endorsing a roadmap. We now need to bring a monitoring and evaluation framework to those member states at a future regional committee and our governing bodies. We need accountability. So we're going to be proposing to develop a benchmarking index, so holding member states a bit more accountable to each other, that mutual accountability I just referred to, sharing the targets and the progress on AMR. And I appreciate what Michael said about that needs to be real time, but I think we would look at maybe an independent regional 53 member state body assisting us, such in the same way as we look at measles and rubella elimination and verification, or Hep B vaccine validation. It's very different. AMR is very different from vaccination. I'm suggesting a peer-to-peer accountability, almost a peer pressure tool that we can introduce. So we're very much looking into this at the moment, maybe to incubate such an accountability mechanism that could then be used at a global level would be something we would like to target. So we're going to be more ambitious, I think, in the years ahead on this measurement aspect, because accountability is so important. And we're all talking the talk, but we're not walking the walk. And that's something that we need to change rapidly.
Rob, totally agree, and a lot of quotable statements here, not for the public, but me, for myself. I liked a lot of the things that you brought. The peer pressure mechanism, I love that one in particular. Lauren, we come to you. Your takeaway on carrots and sticks?
Yeah, I would say, well, driving change is complex, but if I could mention 2 drive changers, I would say incentives and regulatory measures. Incentives as carrots, like positive reinforcements, that is crucial, of course, for encouraging stakeholders to adopt best practices. For example, I would think of the financial incentives, such as subsidies for farmers that adopt strong biosecurity measures, or grants for healthcare facilities with good outcomes within antimicrobial stewardship. It can motivate compliance and innovation through these sectors. The Belgian presidency, through different initiatives such as the AMR conference, also supported fundings and resources for research and development of new antibiotics. We had a panel discussions that you moderated, Dimitra, on sustainable access to antibiotics and research and development of new antibiotics. So yeah, I think incentives play also an important role in fostering public and private partnerships and stimulating investments in AMR solutions. And for the regulatory measure, then it will be more to the sticks. But yeah, incentives are important, but regulatory measures are essential to ensure compliance to AMR policies. And this includes establishing and enforcing strict guidelines on antimicrobial use in animal, but also in veterinary medicine, but also improving surveillance and monitoring systems. The Belgian presidency has advocated for stronger regulations and accountability mechanisms to ensure that all sectors follow the best practices. So yeah, to conclude, I would say that by using a mix of carrots and stick, if I can say, we ensure transparency and also public awareness, as we discussed earlier. We could create maximum opportunity to behavior change, because we all know behavior change is an important topic, but it's also a very complex topic with many different things going around it. So we really need to focus on that and work on it, and also to foster a collaborative and effective response to this global health challenge. Thank you.
Thank you very much, Ran. A really balanced mix of carrots and sticks. Not a big ask at all, but very well taken, the point. Rosé, we come to you briefly, your carrots and sticks takeaway. Yeah.
Well, I'm not going to be very original here. Again, I fully agree with my predecessors. It's a mixture of both, and I also agree with Rob that I would not speak about sanctions, and even less when this requires a global solution. Also, the Commission has traditionally been not very keen in naming and shaming, even if we think that even the mere sort of collective data and publishing reports puts already some peer pressure. I think that this has been learned also by our member states. It also needs to be learned by others working in the ground, the doctors, the vets, dentists, and everyone. We spoke about targets, so I'm not going to expand on this. But targets are, I insist, it's important, and we've seen this. As you probably know, we also had targets on the vet area in the context of Farm to Fork. We had imposed this 50% reduction of total EU sales of antimicrobials for farm animals and aquaculture, and we've seen this in the last SVAC, sorry, again, a horrible acronym, this report by the different agencies that has shown a clear reduction of these sales in the last year. So the progress in the vet side is relatively good, and I think that here the targets work. Reference to legislation. We have legislation, as you also know. We've banned prophylactics in the veterinary medicines regulation. We've banned the use of or the prophylactic use or the use for growth promotion of antibiotics. This has had has a clear repercussion. It also has quite a lot of problems with third countries. So again, we need to see how far we can go with the legislation, which needs also to be enforced. And I know that, and I know that Josep was mentioning this also at the Belgian presidency event. Yeah, we need strong regulations, but we're also very much criticized for that if they are not enforced. So we always need to find a bit of a balance here. And again, the current context calls for also a balanced approach. I would end obviously on the need for a continuous commitment on infection prevention and control, education, awareness, clearly. One last point, also to join what Rob was mentioning. One of the things that appears that we've been pushing for in our non-paper in view of the UNGA is this independent panel that it's for not only for monitor progress, but also, and I'm joining what has been said before, to increase accountability. And this is a key element, and I think that this has been discussed already several times. Maybe this is the opportunity to push for it. Thank you.
Thank you very much. And I think, Jose, very important, the point that you brought about keeping an eye on our carrots and our sticks, whatever they are, to see what their perhaps unintended consequences are. So if some form of regulation gives us problems with third countries, for instance, then we need to adapt and see how it can work better. Michael, last but not least, we'll use your bit also as a closing statement in the interest of time. So give us your short reflection on carrots and sticks, please.
I'll be quite quick. Just reflecting on what Rob says, I think some type of AMR index between countries in the European region really could be a game changer in terms of promoting collective action and accountability. I thoroughly support that, and the idea of an independent panel as well. Like we've written about this. It's an unmet need in the AMR space. An independent panel, not just to promote collective action, but also to create synergies in terms of what we need in evidence generation, because there's so many initiatives taking place internationally, and there's duplication of efforts. So it really could help promote efficiency in terms of investments in broader research. And finally, actually, Dimi, I think I'm going to try and reflect on both of our events this week to just bring it to a close. So we had an event on Tuesday looking at socioeconomic drivers and impacts of AMR, and that emphasizes the importance of sustainable implementation, because we look at these aggregate figures of the health and economic impacts, and that obviously overlooks the fact that the health and economic impacts of AMR are disproportionately felt by vulnerable patient groups, and these are people that maybe are experiencing increased risk of AMR due to occupational exposure, or they're living in overcrowded environments with poor access to water, sanitation and hygiene, or people in conflict zones that are having massive disruptions in their healthcare infrastructure, increased risk of infections from wounds. So I think we need to start integrating the health inequalities agenda and thinking about, reflecting on what Rob says about how we use terminology. We are such a technical group sometimes when we focus on AMR policy, and we forget the fact that other people may be overburdened by that. So we really need to think about our messaging, not just to finance ministers, definitely, but also other people involved in broader public policy that have overlapping initiatives that can prevent resistant infections as well.
Thank you very much. I think, Michael, very clear link. And thank you to all of our panelists for their excellent insights, and to our participants in the chat for their excellent insights and questions. It's been a privilege discussing this with you. We thank you for your patience, also with a little bit of extra time. And of course, keeping AMR on the agenda also means keeping AMR on our agenda. So we will be back with more at some point, and we hope to see you there again soon. Thank you all. Have a nice day. Goodbye.